very common question is how soon are we going to notice, or how soon is the patient going to notice benefit from the platelet-rich plasma injection? So just a reminder of what platelet-rich plasma is. We're trying to isolate platelets out of the blood, and we do that through this process where we spin the blood, isolate the platelets, and so these platelets have a variety of growth factors, cytokines, and other things that can help augment the healing process. So unlike a drug where there's a direct response, this is more of an indirect response where we're trying to stimulate the healing process. So the existing cells in the tissue that we're treating are really doing most of the work, whereas the platelets, this platelet-rich plasma solution, is providing some signals to stimulate those cells to augment that healing process. So as we discuss why it takes so long for the platelet-rich plasma to take effect, we do have to talk about what's involved with the healing process. So there's 3 stages involved with the healing process. The first stage is called the inflammation stage. In an injury, this is typically where the tissue is damaged, there's bleedings, platelets come to the site of injury, different cytokines, growth factors are being released in this specific area. This period can take anywhere from 4 to 6 days. Stage 2 is the migration and proliferation phase. This can take anywhere from 4 to 24 days. So this is where, for example, there may be fibroblasts laying down new collagen, extracellular matrix in that healing process. Often type 3 collagen is laid down first. This is quickly produced. It's kind of like granulation tissue. Stage 3 is the remodeling or maturation phase. So this is where the tissue is remodeled, the extracellular matrix is revised. This stage can last anywhere from a few weeks to up to a year or 2. So as we use the platelet-rich plasma, we're trying to stimulate this healing process, which takes time. It doesn't happen overnight. So typically we don't start seeing improvements for, again, somewhere between 4 to 6 weeks as we're optimizing this healing process. So now if we use an example of skin, stage 1, right with the initial cut, bleed, clots. Stage 2 would be the scab formation, the granulation tissue, and then finally stage 3 is that you start getting more of that normal skin regrowth and scar formation. Depending on the conditions, often we do see a rare improvement in pain, often related to decrease in inflammation based on the platelets and some of the growth factors, cytokines that are present.